While on assumption of office in 2015, President Muhammadu Buhari promised to revamp Nigeria's health sector with the goal of setting up efficient and functional performance management and clinical governance systems that will go a long way in improving the quality of services delivered at both the primary and tertiary healthcare level. However, with just less than 2 weeks to the end of his 8-year tenure, the Buhari-led administration has made little or no significant impact in the nation's healthcare industry, as the long-standing challenges such as underfunding, corruption, poor remuneration, brain drain, inadequate infrastructure, poor leadership, insufficient human resources, and poor health insurance coverage remain unabated. As we count down to the end of this administration, we will be doing an assessment of the state of the Nigerian healthcare sector under Buhari. To do this, we're now being joined virtually from Abuja by the immediate past president of the National Medical Association, Professor Mike Ogirima. Good morning, Prof. Thank you for joining us. Let's begin with your assessment of the Buhari administration in their performance in the healthcare sector. Professor Mike, can you hear me? All right, it will be good, of course, to start on that note, to know how this administration has done. Have they done fairly well? Are there still areas that need to be looked into, especially when it comes to the welfare of doctors, brain drain, infrastructure, and so many issues that have been raised by the medical practitioners? These are the issues we would be looking at, and we would also be setting the agenda for the incoming administration to know what doctors, what the medical practitioners expect, even as we transition into another government. Can you hear me now, Professor Mike Ogirima?
Yes, I can hear you very well.
All right, so I asked what your assessment of this administration is concerning the health sector.
Thank you. The present administration, which is a field light, has done a lot of things, particularly in the health sector. The health indicators, there are indices that we tell about the performance of a country or of a community in terms of health engagement. For example, the maternal mortality rate, which is an index of the rate at which mothers are
that's quite muffled. We can barely hear you. We'd have to take a break now so that when we come back, we'll get a better conversation with Professor Mike Ogirima, who is the past president of the Nigerian Medical Association, NME. Stay with us. All right, still talking about Nigeria's health sector, rating this administration, and of course setting the agenda for the incoming administration. And still with us is Professor Mike Ogirima, immediate past president of the Nigerian Medical Association, NME. Thank you for staying with us, Mr. Ogirima, Professor Ogirima. Well, you were talking about the Buhari administration rating them high in terms of mortality rate. But if you look at our current mortality rate, it is still the highest in the world. That's at 512 deaths per 100,000 live births. And that's, of course, nowhere near the SDG target of 70 per 100,000 live births.
Yes, I will reckon, as I've said, moderately, moderate in terms of performance. Because if you look at where we are coming from, you agree with me that this 512 has been brought down from 814. And that is a progress. And if you look at infant mortality rate, that's the number of children that will die before they are 1 year old, 70 per 1,000, and the under 5 mortality rate 104. I mean, if you look holistically, diabetes, and cancer. Those ones are on the increase. That is globally. So Nigeria is not, exempted.
So in your opinion, sorry to butt in your opinion, Professor, this administration has done well in the health sector. Is that what you're saying?
They've done well.
Okay, so let's look at some of the indices because you have rated them high in terms of maternal mortality. But let's look at funding. For instance, we know that this administration has gone on several borrowing spree, and one would expect that Nigeria should have some high level of funding when it comes to infrastructure. But as we speak, the budgetary allocation is still at a meager 4 to 5%. The highest is the 2023 allocation, which was at 5.75%. Last year, it was at 4.7%. This is not anywhere close to the 15% Abuja declaration, which this government was a pact to. Would you rate the administration high in that regard?
I will still rate the administration, I will still give them a pass mark. Where are we coming from? And where are we now? Yes, the budgetary allocation. We are looking at percentage of what has been mentioned in budget. But when you want to look at the total commitment of the government, we are talking about the federal, the state, and the local government. That figure of 4% or 5% is just a figure. How much have we spent? If you take the cumulative shock from the state, from the partner, and from other extra budgetary allocations or spending, you know that we are just, we should be above that 5% we are quoting. But I'm not saying that is the ideal. The ideal is to achieve 50% based on the agreement. We know, but if we block the drainages, if we block the wastages, you agree with me that a lot has been done by this administration. Look at the area of non-communicable diseases. If you go throughout the country, a lot, to all the tertiary health institutions, you will see a lot of projects, particularly in control of cancer, the prevention of cancer. A lot of money has been voted, and infrastructural developments are there in all the tertiary institutions to control and treat cancer in our own environment. However, we are still bogged down with a lot of high out-of-pocket expenditure. That brings to mind the conversion of National Health Insurance Scheme to National Health Insurance Authority. It is authoritative now that the National Health Insurance Authority will enforce and widen the scope of coverage of health insurance